So we're, of course, going to start with vaccine hesitancy. And I want to start with where things stand in Mississippi. Jackson and Mississippi, more broadly, has one of the lowest rates of vaccination in the country. The state has about 325,000 coronavirus cases and 7,500 deaths. Can you talk about the toll COVID has had on the state and what you're doing to kind of address some of that right now?
Absolutely. I think that the state of Mississippi, upon the last numbers that I received, is about at a 37% vaccination rate, and that's for individuals who have received at least one dose of a vaccine. And the city of Jackson, or Hinds County, which the city of Jackson sits within, is only marginally better at 41%. I think that we have to recognize that vaccine hesitancy is attributable to a number of factors. I think that there is historic mistrust for our healthcare system, some of which I believe we would be appropriately, it would be appropriate for us to recognize as being warranted, knowing some of the historical factors that have led to that. But outside of that, after we combat that issue, we have to understand that in so many circumstances, this pandemic has exposed the inequities that already exist, where we have people who don't have access to regular healthcare physicians, do not traditionally see or go to a doctor within the course of a year, and in some instances, within the span of their lives. We're asking that they deviate from every norm that they have established. It is that important that we build a public relations plan that speaks to that. But understanding that really illustrates just how daunting the task is ahead of us.